founders of Defeat Diabetes, and I have with me tonight two of my colleagues, Paul Mason. Hi, Paul.
Good evening.
And Nicole Moore, our dietitian. Hi, Nicole.
Hi, everyone.
Right, so we're going to be talking inflammation tonight. And just by way of introduction, inflammation has become really, really important. We always used to think of inflammation as sort of acute inflammation, those sort of, hot, red, swollen joints or something like that. Your joint is inflamed. But what we're really talking about now is what they call chronic low-grade inflammation. And it seems that this chronic low-grade inflammation seems to be behind a lot of the chronic diseases that we see in our society. Even something like atherosclerosis, so, coronary heart disease, for instance. We always thought it was all about cholesterol, but now we think it's due to the inflammation affects the artery walls, and they trap the cholesterol as you come along. So inflammation is the key to it. Where there's even some evidence now that things like depression and anxiety might be related to inflammation, let alone many of the other sort of inflammatory conditions that we see around. So this chronic low-grade inflammation is really the key to the cause and the understanding of many of the chronic diseases that we see in our society. So what are the things that influence inflammation? And well, we know that there are lots of lifestyle factors, for want of a better word. I don't like that term, but anyway, lifestyle factors that affect inflammation. One of them is sedentary behavior, so lack of exercise, lack of sleep, stress, smoking, alcohol, lack of sun, all can promote inflammation. But what we're going to talk about tonight really is the role of diet in inflammation. And there's a really a big role of diet in promoting inflammation. In particular, there are really a couple of key dietary components that have been shown to be inflammatory in nature. The first is sugar. We always talk about sugar, and one of the things that sugar does is promote inflammation. But tonight we want to focus more particularly on seed oils, or vegetable oils as they're called, sort of in the community. They're not vegetables at all; they're seeds. But it sounds better, sounds healthier to be called vegetable oils. But we're going to call them seed oils, and they're really the oils from seeds such as canola, sunflower, safflower, soybean oil, corn oil. These seed oils, and that basically have become, well, they're everywhere. Really, they're used in virtually all processed foods. Use these seed oils. We used to cook. Those of you old enough would remember when we cooked in with butter and lard and beef tallow and things like that. And then over the last sort of generation or two, there's been this switch to these cheap vegetable oils or seed oils that are now used for both for cooking and used in processed food. So you go down the middle aisles of the supermarket and see all the processed foods, and virtually all of them will contain these seed oils, in addition to sugar and grains and salt and things. So they're everywhere. They're really important. And for a long time, we were told that these vegetable oils or seed oils are actually healthy, that they're actually better than the traditional oils full of saturated fat, because they reduce your cholesterol. And if we reduce your cholesterol, that must be good for you, and that'll reduce your heart disease. So they were promoted for many years as being a healthy option. Well, you'll be surprised to hear that we don't really agree with that. And I might get Paul to take us through some of the history and some of the reasons why maybe initially we thought, or some people thought, that seed oils were healthy, and what the evidence is now. So over to you, Paul.
Thanks, Peter. So I guess it's this is the same old story, isn't it, Peter? We've just been led down the garden path. We've been misled, and you'd well know this too, Nicole. I mean, with your teaching, you would have had mainstream teaching like I have. You've been taught that saturated fat equals bad, seed oil, vegetable oil equals good. And the notion of this, again, is due to the properties in supposedly lowering LDL cholesterol. The problem is the chemical property of seed oils, which allows them to be liquid, is also the chemical property that makes them very reactive. And they can actually do damage to the tissues of our bodies through something called free radicals. So the way to understand it is, and we don't really have to get down into the nitty-gritty of it, but having different kinds of bonds can determine whether a fat is an oil or a solid. And seed oils have a particular kind of bond that is very reactive. In the same way that metal can rust through a process called oxidation, these oils are actually oxidized in the bottle. And they actually have to put them through a lot of industrial processes like bleaching and, trying to deodorize them. Otherwise, we would absolutely never consume them. And it's not a stretch to say that they were originally machine lubricants that then were repurposed as an industrialized food item. Now, the problem is that when we consume vegetable and seed oils, we consume these oxidation products, and that leads to inflammation inside us. Basically, what happens is through our digestive tract, these things called free radicals, otherwise you might have heard the term reactive oxygen species, it's just another way of saying the same thing, these get absorbed across our intestines and enter our bloodstream where they get delivered to the liver. And when they get to the liver, they can actually directly cause something called fatty liver disease, which most people would have heard about, and is strongly associated with something called insulin resistance, which again, most diabetics, if they haven't heard about it, they've certainly experienced it because that's one of the core problems in type 2 diabetes. It's insulin resistance that actually prevents you from controlling your blood glucose levels effectively. Now, I don't know, have you ever come across the rose corn oil study, Peter? It's an old one.
I have. It's an oldie but a goodie.
And I quite like it because we have actually talked about this before, so that was a bit of a loaded question. But they did some, as well as finding that the people who consume the corn oil were more likely to die, which we can put aside for a moment, they had some subjects who were diabetic. And as you know, in previous, ancient eras, we're talking many hundreds of years ago, one of the main ways that diabetes was diagnosed was by actually tasting somebody's urine. This is because diabetes is a condition where the sugar in the blood goes too high. And if it gets excessively high, some of that sugar actually leaks out into the urine. We get overflow. So there's actually accounts of ancient people where they would document that people who were sick before they were about to die, the ants would actually come and feed on their urine, hunting out the sugar. So basically, the point is, if you have sugar in your urine, it's a bad sign, and it's often associated with diabetes. Now, in the Rose corn oil study, Rose was just the name of the lead investigator, they actually identified that subjects, when they consumed the corn oil, they developed this sugar in their urine. When they stopped the corn oil, the sugar went away. And then they trialed it again. This is what we call an ABA design. And they did the intervention again. They gave the corn oil back and the sugar came back. And they could do this as many times as they wanted. They were able to definitively demonstrate that the consumption of a vegetable or a seed oil in place of the regular saturated fat was actually associated with worsening control of the diabetes. And this is, the group we're talking to tonight, Peter, this is a Defeat Diabetes audience. This is people who are concerned about their metabolic health. They don't want fatty liver. This is an incredibly important message for those people to hear. And it's not just about the diabetes. And so obviously we say, well, you consume the seed oils, you get a little bit of sugar in your urine. Is it really that much of a problem? So you'd be familiar with the Sydney Diet Heart Study. So this was actually ran between 1966 and 1973 from memory, approximately those years. And they actually recruited males who had had heart attacks. So the population you would consider very, very high risk. And then they randomized them to either go on a standard diet to keep on having what you were having, which was saturated fat-rich foods, no doubt, or to take out the saturated fats in their diet and replace it with seed oils. And what they actually found was that the males who consumed the seed oils actually had an increased death rate of 62%. Hugely significant increase in death rate. So it's not just some kind of esoteric or abstract concept we're talking about. We'll say, you consume seed oils and you absorb this oxidative stress, and it might make these metrics bad. The final outcome that we really care about, which is good health and longevity, that is significantly impaired. And I won't bore everybody with other studies. I'm sure as you've heard me talking on this subject before, you've probably heard me talk about it ad nauseum. But there is a couple of other points that we do need to talk about. One of them being that if you are a diabetic, then the oxidation from seed oils is far more damaging to you than a non-diabetic. So they did this really elegant study where they had subjects actually consume oxidized oil, and then they measured their blood to see how long they had these circulating free radicals in their blood for, and understand that these free radicals, when they're circulating, they're not benign. They're doing bad stuff. They're damaging. And they found that diabetics with good control of their sugars or non-diabetics, they could detect these free radicals for 8 hours on average. Poorly controlled diabetics, care to hazard a guess, Nicole or Peter, how long they lasted for?
What, twice that?
9 times longer, 72 hours longer. So the persistence of these free radicals in the circulation doing damage that was measurable following consumption of a seed oil was 8 hours versus 3 days. So just consider that for a moment. So again, this is not some esoteric abstract construct that is irrelevant to diabetes. It is incredibly relevant. And this goes to the heart of what you talk about, Peter. You talk about real food. So it's not just about, this macronutrient or that macronutrient. It's about having the combination or avoiding the combination of ingredients that are found in industrially produced foods. And obviously that includes sugars, carbohydrates coming in under that umbrella, and seed oil. So it's a deadly combination. It's not one or the other in isolation. Now, if I can, I know I'm chatting for a bit long here, but there's just one more point if I can sneak it in. You mentioned how seed oils might actually affect appetite, and this is something that a lot of people don't know about. There's a term of something called nutritional immunity. And what it actually means is that our immune systems have got a fantastic strategy where our bodies understand that pathogens that will infect us, things like viruses and bacteria, different parasites, they rely on iron to survive. And as far as they're concerned, we're a smorgasbord. We've got iron circulating around in our blood, ready to go. Now, with our immune system, when we get an inflammation trigger, our body does its best to take that iron out of our free circulation and push it into storage. So what we call our serum iron, which is the free iron in our blood, will actually go down, and the iron in our storage reservoirs called ferritin will actually go up. And that has a beautiful effect because it effectively starves these pathogens of the iron they need. And our immune systems can go on and do their business and eradicate the infection. And then once the infection's gone, that inflammatory signal from the infection is removed and the iron level is restored back to normal in our blood. The trouble is when we have inflammation from artificial causes, things like seed oils, which we know are inflammatory, well, we don't ever get any respite from this concept of nutritional immunity. It means that the level of circulating iron is always going to be lower. It's not going to be transient lower for a week or two. It's going to be lower for as long as you're inflamed. And if you've got chronic disease, that can be months and years at a time. And this has very real consequences. And one of them is actually on binge eating, believe it or not. So the chemicals in our brain that make us feel good. So human survival is predicated on two behaviors, procreation and eating. And they're driven by these chemicals in our brain called the catecholaminergic neurotransmitters, so dopamine and serotonin. And they both have an iron-dependent synthesis. In plain English, we need iron to make these chemicals. And without having sufficient iron, as in if in an inflamed state, our production of these chemicals is going to be suppressed. And this is absolutely provable biochemistry 101. Now, if we have less of these chemicals and understand that we're hardwired, we have this physiological drive to chase these chemicals, remember the behaviors of eating and procreation are actually driven by these chemicals. That's how the human brain is hardwired. So without these chemicals, we have an urge to engage in behaviors that will actually lift that grey veil, if you will, of apathy from us and actually give us a squirt of these chemicals into our brain. And what's the most reliable way of doing that in our modern society? Junk food. It's ready, it's always accessible, and it's been crafted to have what we call the bliss point, which is basically to make it as appealing and addictive as possible to squirt these chemicals back in. So we end up in this situation where we become chronically inflamed. We actually have suppression of our body's ability to synthesize dopamine and serotonin, and that then sets us up to have these cravings. So a lot of people, they'll know that they're not hungry, they'll instinctively know they're not hungry, and yet they'll have this insatiable urge for cravings, for eating something like an ice cream or something like that. And the understanding is that that urge is actually driven by the chemistry within the brain. It's not a need for nutrients. It's a need for a warm hug from food. And I think I've prattled on a little bit long there, so I probably should wind it up.
Right. Thanks, Paul. That's fascinating. But before we get to Nicole, I just want to go back to the Sydney Diet Heart Study, because what they promoted from that study was that the polyunsaturated fats, the seed oils, were actually healthier than the saturated, which was exact opposite to what the results showed. So tell us a little bit about that, and because there are a number of other similar studies as well, the Minnesota study as well, that they promoted, or basically they lied about the results. Is that
it was a cover-up. It was an out-and-out cover-up. So as I said, the study was finished in 1973, and yet the data on mortality was not published until 2014. And that was actually uncovered by a researcher by the name of Dr. Christopher Ramsden, who actually found it in the basement of one of the deceased lead investigators. And they had to go and retrawl it out. It was on magnetic tapes and data sets and punch cards, I kid you not. And they had to go and they had to go to a computer laboratory who was able to get some ancient computer equipment so they could decode it. And then they had to validate it against the known population data to make sure it was reliable. But they were able to validate the data to a sufficient level where it was able to be published in the British Medical Journal, one of the world's leading and most prestigious journals. And the curious thing here is, and I'll just leave you with a thought bubble. So given that this study predated the food pyramid, the implementation of the food pyramid, if that data had not been covered up, would we have ever been subjected to the food pyramid, were it not for the deceit of these researchers?
Yeah, there's really been a giant cover-up of all those studies comparing polyunsaturated and saturated fats. Clearly showed that there was no advantage to polyunsaturated fats, but that was not the message that was sent out after the studies. And as you said, if they found a finding that they didn't like, they just didn't publish it. So it was
and I think
basically fraudulent research.
As you say, it's not an isolated finding. We've just talked about one, but the Women's Health Initiative, the Minnesota Coronary Experiment, there are two other large-scale randomized controlled trials. And when we're talking about the hierarchy of medical evidence, understand that this study design is at the very top. So a lot of these food pyramid advocates will cite what we call epidemiological research, which is way down the bottom, while ignoring the best quality experimental research we have. It's a complete non sequitur. I
think I read somewhere that where there's been trials involving 75,000 people comparing saturated and polyunsaturated fats, and none of them have shown any advantage to the polyunsaturated fats, despite what the medical profession, the government, and more importantly, the food industry would want us to believe. But we might leave that for the moment, because I think, from what Paul said, and there's clear evidence now that these polyunsaturated fats, these seed oils, are not good for you. I mean, they're detrimental to your health. So, Nicole, from a food point of view, I mean, where do we find them, and how do we reduce our reliance, I guess, on these seed oils?
Yeah, well, I guess as Paul was talking about as well, is that if we're eating unprocessed and real food, then I guess that's the best way to avoid that whole bucket of seed oil issue. As I talk to a lot of my clients, the first thing we sort of run down is, understanding how to avoid sugar and how to reduce total carbohydrate intake in their diet. And I go through label reading with them so that they can navigate, what's a low carb, no added sugar product. Once we've done that, then we really have to start navigating the whole seed vegetable oil issue, which is really about them checking their ingredients lists really carefully. Again, if we're going down the unprocessed pathway and we're eating, good quality protein like meat, chicken, fish, eggs, these don't really have ingredients lists. So, I always say if it doesn't really have an ingredients list, then you're eating real food. So ideally it's about checking an ingredients list or checking your labels and looking for soybean oils, corn oils, cottonseed oil, sunflower oils, safflower oils, hydrogenated vegetable oils. And if we see those words, even if that product is particularly showing that it doesn't have a lot of carbohydrate in it and doesn't have sugar, we need to be navigating the ingredients list to make sure that it doesn't have those fats in them as well. I'm always sort of telling my, my clients that come in is that, if you're reading an ingredients list and it does have some ingredients in there, is, checking for real fat, making sure it's got butter or it's got ghee or it's got lard or it's got tallow or it's got some duck fat or, it doesn't have any of those nasty oils in there. So it's real fat, use butter, use ghee, use lard, use tallow for cooking. Look at all your sauces and dressings. Unfortunately, most things out there, if they're in the supermarket aisle, are going to have those particular fats in there. So I try to really encourage my clients, where possible, to be making their own marinades with a coconut oil or a butter with herbs in it, or using cold pressed olive oil, and trying to create their own marinades and sauces and dressings and mayonnaises using real fat. Looking for products that potentially are made with those good fats. But everything that's, in that supermarket aisle, if it's got an ingredients list, most of the time, unfortunately, it's going to have those seed oils in there. So I guess that's how I navigate people. It's, using butter and not Nuttelex and, margarine, and, trying to, if you're going to be frying, is to use a coconut oil or to use butter or ghee or lard or tallow, because we know, as Paul was mentioning, they don't have the bonds in that oxidize and they're stable fats. And to, be careful even when eating out. You see all these restaurants saying, oh, it's cooked in healthy vegetable oil. And number one, that's always a canola oil or a vegetable oil or a seed oil of some form, which, as we know, when those omega-6s are oxidized, that's when it becomes a danger to our bodies. And then those oils are reheated over and over and over again. So, it's creating even worse radical damage that's going to happen to our bodies and insulin resistance. So I guess they're the main things I really talk about, is navigating labels and trying to go for those products that are real foods that don't really have necessarily ingredients, but looking for those seed oils. And, I see a lot of clients that sometimes come in and they've understood the message of sugar and carbohydrates, and they're focusing on proteins and above ground non-starchy veggies, but they're using a lot of sauces and dressings and marinades or diet products that have all these nasty oils in, and they're still not seeing improvements in their health and their diabetes and their blood glucose, because as Paul has said, is that's a, and that's an even bigger issue for some people, is that, a small percentage even of those oils can be doing even more damage than the sugar itself. So I guess that's the education path I go down with my clients to help them navigate the whole seed vegetable oil issue out there.
Right. Take us through the margarine versus butter sort of argument, because there's a whole generation really where we were told that we should stop eating butter and margarine was healthy and so on. What is margarine?
Well, I guess the simplicity of what I talk to my clients about and is that margarine is a vegetable or a seed oil. Even when you see the spreads, like the butter spreads, when you read the ingredients, you still see your seed and vegetable oils mixed into that to make it spreadable. And I remember, Peter, you doing a talk once showing this great picture of the butter and the margarine, and that the ants could determine which was the real fat and which was the fake fat. And again, we know that it's not the saturated fat; it's the LDLs being damaged by the sugars and the seed oils to create oxidation. I guess it's it's a bucket of vegetable oil still, and don't be fooled by those spreadable butters, because they're still mostly seed and vegetable oils as well. So
Right. Well, we'll get to your questions in a moment. But one more thing. I mean, we hear a lot about olive oil. I mean, is olive oil, in the seed oil basket? Is that something we should avoid, or is that somewhat different?
Well, look, I guess how I approach olive oil is, and Paul, you'll, I'm sure, have something to add to this as well, is that I try to encourage people to use olive oil. I guess I call it raw. So, without cooking with it, because it's still, is potentially something that oxidizes, not as much as I'm aware as the other seed oils. So I try to encourage people to technically use olive oil sort of more as a dressing, or as an uncooked product to drizzle over food, versus cooking with it, and then try to stick to more the stable saturated fats for cooking.
Yep, I think that's probably pretty good advice. All right. Look, before we go to the questions, I've just got encourage you to head to the link on the screen or in the comments to claim your free, fresh and simple e-cookbook, which has 15 low carb recipes. So it's a special offer for those of you watching tonight. So go for that and grab your free cookbook, and that every entry will then automatically go into the draw to win one of 5 12 months Defeat Diabetes memberships, and that closes on Sunday the 8th of May. So grab your cookbook, and then you've got a chance of winning a 12-month membership. All right, let's go to the questions, shall we? And oh boy, there's tons of them. That's great. Keep them coming. We'll try and get through them all. So, Paul, can you explain what are some of the lesser-known ways inflammation shows up in the body, and the best way to eradicate it? So, what are the diseases and so on that are and processes that are linked to inflammation, as far as you're aware?
Well, I mean, inflammation is a term I personally don't like, because it's got such a protean presentation. It can be so varied. So you might have a rash, you might have psoriasis, you might have flaky skin, you might have an aching joint, an aching big toe, an aching knee. You might be depressed, and in a lot of cases, depression and anxiety can be consequent to inflammation. You might have abdominal pain. It really can manifest in any number of ways. So I think it's much better to just say it's the absence of inflammation, which is actually what defines good health. The simple fact is that we've got a couple of blood tests where we actually can measure, and they're very crude measures of inflammation. They're what we call sensitive, but not specific. What that means is that if you are inflamed, these markers will likely be out of whack. But if they're out of whack, it won't tell you where the source of inflammation is. It could have been a cold that you got 2 days ago. You could have broken your toe. You could have a rash, what have you. So they're very imprecise. But one of these markers is called C-reactive protein. And when we actually look at people's longevity, versus their C-reactive protein, we find that the people with the very highest levels do incredibly poorly. And the interesting thing about this is that the normal reference range on the blood tests actually is usually between 0 and 5, when we've actually got very, very good research that anything over 1 and probably over half is actually associated with early mortality. So I guess in terms of how can we present, well, if you're not feeling 100%, there's a very good chance that you are carrying inflammation of some sort. You know, that could be autoimmune inflammation, where your immune system is attacking you. That could be an infection, your body responding to an infection. That could be something like a cancer. It could be a physical trauma where you've sprained your ankle. There's multiple ways that you can sustain inflammation. The problem is, though, that once you are inflamed, you're in a far worse state of health, and there's only one solution, and that's to try and improve it. And don't trust the standard reference range on bloods, because that is not set based on what is optimal for your health. When your doctor looks at that and says, oh, your CRP is 3, well done, because it's under the 5 that the flag post is set, that is not a marker of good health. So that's set based on 95% of the population. If you walk around the shops now, you can see that 95% of the population is unhealthy rather than being healthy. And we're using 95% of the population to determine what inflammatory goals we should aim for on bloods. That's just crazy.
Great. Zeb in New Zealand's got a question. What are the common outward signs of inflammation?
Well, pain. I mean, we learnt these in Latin, rubor, calor, dolor, these kind of things. And you'll be more proficient in that than I, as we've already established. I'll just go with redness and pain and so on and so forth.
Sounds much better.
But basically, look, if you have pain, you're probably inflamed. If you have a defect in your skin, you're probably inflamed. We're now understanding this concept of what we call neural inflammation, whereas we know mental conditions such as schizophrenia, bipolar disease, severe depression, anxiety, these are associated with inflammation of the nervous system. So if you're not in optimal health, you're going to be inflamed.
Mm.
And what about edema? Zeb also wanted to know about that she'd gone on to a low-carb diet and seen her edema reduce. Not completely go away, but reduce. So why would that be? Is that related to inflammation?
It could be. And that's a very unhelpful answer. So let me try and provide a little bit of nuance there. So one of the causes, it depends on where the inflammation is. Let's assume that this is leg swelling, which is very, very common. Essentially, if your heart is not working properly, that can lead to swelling of your legs. Basically, what happens is that the blood vessels in the legs, they're like long pipes that go up to the heart. And the heart is meant to receive the fluid coming up these pipes and pump it through. Now, if the heart isn't able to pump the blood through or receive it properly, then the pressure in these pipes builds up. It becomes excessive. And in that case, some of the excess fluid can actually seep across the wall, what we call hydrostatic pressure. And when that fluid that seeps across the wall of the blood vessels, that will actually waterlog the tissue. And as doctors, we can often diagnose this by putting our big, ugly thumbs into the shins and keeping it there for a few seconds. And when we take it away, it can leave a dimple. And that's what we call pitting edema. And if you see pitting edema, that can be a sign, basically, potentially, not always, but potentially a sign of something we call congestive cardiac failure, an early sign where the heart is just struggling to do its job properly. So if that's the kind of edema you're talking about, and that's getting better, that's a good thing. And it's probably because your heart is more effective. One of the other reasons I commonly see in my patients with swelling of the legs is that if they have a lot of abdominal fat, it can actually compress the veins around their pelvis region. And that will also lead to the blood pressure building up in the same way that the heart not working properly will, and the fluid can seep across the blood vessels again. So that's probably the kind of edema or swelling that Zeb is talking about. But of course, there's other kinds. If you have an infection or if your immune system is attacking your joint, such as a rheumatoid arthritis, or if you have an attack of gout, then you'll have a localized swelling to the particular joint that's affected.
Okay, Kylie made the comment, just looked at our butter spread, 28% vegetable oil. Is that pretty standard, Nicole?
Yep.
So one for you, Nicole. How does a vegetarian or even a vegan navigate this minefield? Andrew says he's not a vegan, but he is vegetarian. So what advice would you give to those people?
Yeah, well, look, I mean, one of the things always is getting, we touched on, I guess, the omega-6s and getting enough omega-3. And often I talk about, using algae and seaweed and those sorts of things because they have good omega-3 content. I think with the vegetarian and vegan, the big problem I see a lot is that the reliance on all this sort of plant meat, so to speak, and they're just so processed and so full of, seed and vegetable oils and, ingredients list this long. I think what it comes down to is using your raw food as much as you can, your nuts and your seeds. I would still be including a lot more fat in the diet in terms of avocados and coconut oil and, uncooked olive oil to get good fats in there. From a protein perspective, I'm relying on a lot of nuts and seeds, and we will be relying on, certain beans and legumes and lower carbohydrate beans like lupini beans. You're going to have to be creative because, you're going to have to find recipes using real food because the supermarket just getting overwhelmed with so much processed vegan plant replacements that they're going to be worse off and more unhealthy than ever because of all of the oxidized oils and, ingredients that are in there. So I think from a vegan perspective, I would be using as good quality tofu as I can, good protein, and again, lots of good fats and nuts and seeds and low carb beans and legumes to try and create the balance with plenty of, above ground green leafy veggies. So keeping it as real as possible is so important because I'm seeing so many vegan people coming in really, really sick and inflamed with a lot of gut problems and feeling super tired because they're relying on trying to get their protein, particularly from all this processed food. So I guess that's my advice, and then trying to give them ideas of how they can create meals around those real food products.
Right, a few comments from our listeners. Pamela says she has an inflammatory disease, lipedema, not lymphedema, but lipedema, which is different. Been on a keto diet, which often works really well for lipedema, and it's helped her pain and visible in her face. She's not as puffy. Well, she's not losing weight, but be patient. Bruce suggests native coconut oil is good for cooking when mixed 50% with butter to mitigate the coconut flavors. Nicole, you tried that?
I haven't, but that sounds pretty good.
Yeah.
That's what people do say is the coconut oil flavour. So I think that's a great idea.
Jan commented on polymyalgia, Paul. Is that something that would respond to this sort of regime?
Well, absolutely. So, when I say absolute, yes and no, but it is absolutely an inflammatory disorder. So I referred to a couple of blood tests before, and I mentioned one particularly called the C-reactive protein. That's a great marker for inflammation. Well, polymyalgia rheumatica is actually usually associated with very high levels of something else called ESR, which stands for erythrocyte sedimentation rate. Now, basically, that's a really long term, but erythrocyte means red blood cell, and sedimentation rate just means the sediment like you get at the bottom of a glass of orange juice when you used to drink it. So what it actually does is that when our red blood cells, when we're inflamed, we actually have a little protein called fibrinogen that actually coats our red blood cells and makes them stick together. And when they clump together, they're more likely to they get denser and they fall down to the bottom of the fluid, so they sediment out. Now, this ESR, or erythrocyte sedimentation rate, is a major diagnostic criteria for the disease of polymyalgia rheumatica. And frequently when people go on diets that lower their inflammation, we see a significant lowering of their ESR. And again, in the same way that the reference range for CRP, I think, is unrealistically optimistic, then I think the diagnostic threshold for ESR is also set far, far too high. And one of the problems is that our laboratories don't account for something called healthy aging. The notion that you should be as healthy in your 60s as you were in your 30s is just foreign to these reference ranges. So a case in point is that for a 20-year-old person, the upper limit of the reference range for ESR might be 15, and yet for somebody who's a bit older, it will be set at double that at 30. They're quite literally accepting double the inflammation in somebody just because they're a little bit older, which makes no plausible biological sense. And it sort of discounts the possibility that we can actually age healthily in modern society. And maybe that's an indictment on modern lifestyle.
Right. Couple of other ones from Pamela. If I suspect metabolic syndrome or insulin resistance, do you suggest anything that can be done with which may assist? Well, we could talk about that all night. But basically, I think we'd all agree that a real food, sort of low carb dietary intake has a huge impact on metabolic syndrome and insulin resistance. But maybe we'll save that for another Facebook Live. I think we have one caller who has told us, admitted that his or her, I think her CRP is 13, which certainly, Paul, you'd regard as quite high and indicative of an inflammatory process going on within their body. Is that fair to say?
Look, I would say that's a huge problem. Now, just to, not medical advice, but just to talk about the approach that I would go through when I have a patient who comes in with what is otherwise an unexplained inflammatory state. You need to, if we break it down into the most common causes, so you need to first of all rule out an infection. So if you've had a cough or a cold in the weeks before the blood test, then that might be lingering. You know, if you've got a residual chesty cough or something like that, if you've got a history of gout or something like that, it could be an inflammatory arthritis like gout. Make sure that's not it. You also need to look at it over a few years, because there is always the ever-present risk of a cancer, but cancer will usually have a higher level of inflammation and it won't be stable over a number of years. Unfortunately, when you get a blood test done, the laboratory will actually show you, or show your doctor, the previous 4 or 5 results you've had, which often spans a number of years, even decades in some cases. And that can be very reassuring in terms of making cancer very much less likely. If you can see, yes, you have had elevated inflammatory markers of CRP, but it's actually been consistently elevated for a number of years and it's non-progressive. So that gives you an element of reassurance. So if you've sort of, excluded by default those possibilities, then it raises the spectre that you might be facing something called an autoimmune inflammation. And that also is something that can be triggered by diet. Now, the job of your immune system is to protect you from foreign pathogens. So if you get a virus in your blood, let's say your immune system is meant to be able to look at that virus, identify it, say, you're not from these parts, you're foreign, and kill it. But it's also meant to leave the circulating red blood cells and white blood cells that are immediately adjacent to it well alone. Now, there can be a case of mistaken identity with autoimmune disease. And autoimmune disease basically means the immune system gets it wrong and it starts attacking things that it shouldn't attack. The attack is from within. And frequently when I see patients with this, moderate level inflammation that's been bumping along for a number of years, it's often autoimmune in basis, and that too frequently has dietary triggers, but it's just slightly different dietary triggers to straight carbohydrates.
Right. Look, we're running out of time. We've got a whole bunch of questions, so let's quickly go through some. Andrew's queried our comment before that I think both Paul and I made, that depression is related to inflammation, and that's something that's a relatively new concept. I read a fascinating book called The Inflamed Mind by a professor of psychiatry at Queen's College in London. And if you're interested, that's a really interesting book to look at. Unfortunately, he didn't understand the causes of inflammation, but he did realize that there was a link between depression and anxiety and inflammation. And I think that's a really interesting area of future research.
Well, if I can just make a comment there, Peter.
Oh, I thought you would, yes, yeah.
Not entirely new. So I read a paper from 1984 recently that actually had people with a condition called celiac disease, which is an autoimmune disease. And they actually measured the fluid around their brain for serotonin. And they actually found that when they fed them gluten, their serotonin level around their brain dropped. And when they restricted gluten from their diet, it actually was restored again. So we have actually known about this for several decades. It's just not appreciated by many.
I've always been behind the times, Paul. Nicole, you mentioned tofu. Pauline's got some concerns about anti-nutrients in tofu. Tell us your take on tofu.
Look, I mean, again, for me, when it comes to a vegan diet particularly, I mean, we have limitations with what can be included. So I think it's all about making sure that they've just got a wide variety of, I guess, vegetables and nuts and seeds, and they're using different types of proteins together to sort of counteract it. But again, because, from a vegan perspective, there's a limitation of the proteins that they can have. I'm still not necessarily concerned about that as long as we're getting variety with a lot of the things that they're putting in there. If you take tofu out, there's not a lot of other things left for them. So I guess that's where we just try and, add lots of different types of protein options in.
Right. Now, while I've got you, Nicole, we've mentioned that we don't like peanut oil, but what about eating peanuts as a keto snack? Is that okay, or should they be avoided?
Well, look, I think when it comes to nuts and seeds, it's best to either have them dry roasted or not definitely cooked in any seed or vegetable oils. As Paul's mentioned in previous discussions as well, it's not the omega-6 per se in nuts and seeds that's an issue. It's the oxidisation and the process they go through when they're heated and made into oils. So from a nuts and seed, as long as you're eating, fresh and raw and they're not rancid and they haven't been sitting on a shelf, and you can smell that, if you even a seeded cracker, if it, or seeds and nuts, if they're rancid, they're going to have a fairly nasty smell to them. So as long as they're not, made into an oil and they're cooked, they're used fresh and then there's no problems with that.
Okay. What about apple cider vinegar? What are your thoughts on that? It's a very popular adjunct these days.
Look, I guess from what literature I've read is that you can use apple cider vinegar as an ability to sort of help lower we'll call it glycemic load of food, reduce the amount of carbohydrate that is in a meal, can slow it down. But again, if you're consuming a low carbohydrate diet with, good quality real food, I don't see it as a necessary thing, but you do hear people saying it helps with the digestion. And again, there is some concept of combining it with meals can sort of lower the glycemic load of food. So I guess, from that perspective, I leave it up to the individual to use if they find it, it helps with their indigestion or their reflux. I don't see any harm in using it either way. So, yeah.
Right.
One benefit that you can actually have from apple cider vinegar, and I don't fully recommend it, but it is a fatty acid, and it actually is a very ketogenic fatty acid, so it can help some people get into ketosis.
Right. Okay. Comment from Jenny. My fibromyalgia and osteoarthritis is much better on low carb. She's added regular ocean dipping, no pain in the cold water, and vitamin D top-ups as well. So that's good to hear. What else have we got? We've got someone asking about Hashimoto's disease, but I think we might cover that in a future one, Paul, because I know you've got some thoughts on thyroid conditions and so on. Judith says she's recently noticed on packets of nuts and dried fruits that have seed oils in the ingredients list. Well, again, it says don't buy anything in a packet. And I thought the last question that is something that you and I have often discussed, Paul, is do we consider dairy to be pro-inflammatory or not? And I'll give my 2 bobs worth, and then you can do the same, Nicole and Paul. I mean, I think certainly for some people, dairy is inflammatory. There's no doubt about that. That if you remove dairy, I think it's a minority of people. I think there are a number of issues with dairy. Obviously, there's people who are lactose intolerant. There's people who are sort of sensitive to the different proteins in dairy. But I think as far as inflammation goes, I think it's maybe half, or maybe roughly half the people probably it's inflammatory, and half seem to cope very well with dairy. First with you, Nicole, and then Paul, of course, will have the last word.
Look, I do definitely find that some of my clients that come in who are doing a ketogenic or a low carb diet, and they seem to get stuck, even if they're not getting signs of gut issues or problems with lactose. I do find taking them off dairy seems to get them back into their improvements in their blood glucose reduction or their weight. And I guess for me, the two things with dairy is that you've got things like, milk, and you've got yogurt. And from a carbohydrate perspective, if people are loading up on that, they're actually getting still a high intake of carbohydrate, which can be part of possibly the issue. Again, if I find they get stuck, I just find taking them off dairy just seems to get them back into further improving their health. So it is something that I always look out for, and will recommend people go off if we're not further improving their diabetes or their blood glucose or their weight. So I guess that's how I approach it.
All right, Paul, you got 2 minutes.
I couldn't agree more, Nicole. And I found a lot of my patients were reporting significant clinical improvements when they cut out dairy. So I was trying to figure out why. And then there was a couple of things. So we know, one, that it can cause insulin resistance. So they've done studies where they've actually fed study subjects an equivalent amount of meat-based protein or dairy-based protein. And they've actually found that within the space of 1 week, there was a measurable increase in insulin resistance in the dairy protein group. We also know that a lot of people, now you mentioned that even in people without gut symptoms, but let's not exclude those people, because a lot of people with gut symptoms don't realise they're being triggered by dairy. And some people will complain of constipation on low carbohydrate diets. Now, as doctors, medical professionals, we know that morphine or opiate-based drugs can cause constipation. Well, there's a chemical found in dairy called casomorphine. It's an opiate. And in the same way, that's why dairy is so nice. And that's why a lot of people overeat dairy on a low-carb diet, because it's got this addictive casomorphine in it. And 2, that's also got constipation causing potential. And 3, we know it can also trigger these low-grade inflammations. So when I said it's often autoimmune inflammation, so this is some research from 1931, which I actually came across recently. Now, it's a study of the Maasai tribes people versus an adjacent tribe in Africa called the Akakuyu. Now, the Maasai consume prodigious amounts of dairy and meat, while the Akakuyu tribe was a vegetarian tribe. It was beautifully set up, and they were genetically similar because they were intermixing within marriage. And what they found, that the Maasai were 50% stronger, 5 inches taller, they had less diabetes, less ulcers, less dental cavities, so on and so forth, except in one metric, well, 2 metrics they were worse in. They had more constipation, which now we understand is a beta-casomorphine, and they also had more autoimmune disease. They had a far, far higher rate of rheumatoid arthritis, which is an autoimmune arthritis. So I think that really speaks to the possibility that dairy is not benign for everybody, and it can cause some people some problems. So I do have to agree with you, Peter, certainly not everybody. And I do see a very biased sample in clinic. In my patients, I see the people who are struggling. But of the people who are struggling, dairy is often the culprit.
Well, that wasn't bad, Paul. 4 minutes instead of 2. That's good. Nicole, just one last thing. Do you differentiate different types of dairy? I mean, are you less likely to be sensitive to something like yogurt rather than milk or even cheese? Where does that all stand, both of you?
Well, again, it depends on what we're referring to. I think if you're talking about gut, just from a lactose issue, I do certainly find that people probably tolerate cheese more so than they might tolerate milk, and yogurt can kind of sit in the middle. When it comes to the insulin resistance and progressing with their wellness improvements and their weight, then I would pretty much go cow milk free for that particular situation. But from a gut perspective, I'll take it out and then we'll add back and work out, what is it that they're reacting to. But definitely people will react to different types of dairy, and often it's the higher lactose containing things. But definitely I would do completely cow milk free if I was if someone was struggling on their low carb journey for weight, or for their diabetes or pre-diabetes and we weren't progressing.
Yeah, it's certainly worth a try, isn't it? Right, look, we better finish up now. I think our time's up. Just a reminder to go to the link to claim your free cookbook and to have a chance to win one of the Defeat Diabetes memberships. So that'll be great. So thank you, Paul and Nicole, and thank you all for joining in. We'll be back next month to listen to more pearls of wisdom from Paul and Nicole. See you later.